Hello. Today we're going to be discussing the role competency of collaboration. Our group consists of myself, Clint Cooksey, Lindsay Myers, Carmen Rollins, Alicia DeMint, Lance Hennigan, Jennifer Waddell, Jolie Ainsworth, and Mandy Cloud. Hansen and Spross define collaboration as a dynamic interpersonal process in which two or more individuals make a commitment to each other to interact authentically and constructively to solve problems and to learn from each other to accomplish identified goals, purposes, or outcomes. The individuals recognize and articulate the shared values that make this commitment possible. This definition covers multiple facets of collaboration. It insinuates that the collaborators are dependent on one another for completing their goals, and also implies that it's okay for the collaborators to have differing opinions as long as they're learning from one another and working toward the same goal. True collaboration engages the head, the heart, and the will. Partners need to be all in and don't need to leave any part of themselves behind. Partners share the work and develop ways of supporting each other. Although all types of interactions do not always require collaboration, collaboration likely enhances many of these interactions.
My name is Lindsay Myers, and I'm going to be discussing where collaboration is at in Hemrick's framework. Collaboration is one of the 7 core competencies in Hemrick's framework, and it is one of 2 competencies that is not well recognized. There are 3 spheres that involve collaboration. The first sphere is patient-client. This is collaborating with patients and their families. The second sphere is the nursing sphere. This is attending staff meetings, participating in interdisciplinary clinical rounds. The last sphere is systems and organizational. This is clinical seminars, preceptor discussions on role implementation, their challenges and successes. Collaborations with individuals. APNs aim to understand how the patient wants to work with the APN and other providers. APNs also collaborate with individual clinicians. Collaboration with teams or groups. APNs facilitate teamwork to ensure the delivery of effective, high-quality care. Collaboration in organizations. The aim in this category is to clarify credentialing requirements. It makes it easier to practice across state lines and improve reimbursement for the APN.
My name is Alicia DeMint. This is just a funny picture about collaboration that we found for everyone. I'm going to discuss some essential characteristics of collaboration. They are clinical competence and accountability, a common purpose, interpersonal competence, effective communication, trust, mutual respect, value of diverse knowledge and skills, and humor. Trust must be developed over time. Respect is also a basic quality that allows for understanding, growth, and development of trust. Affording each individual member mutual respect is essential as each person brings their own personal experiences, educational skills, and professional maturity. Collaboration is accomplished when each participant recognizes the valued assets of the other members. Clinical competence may possibly be the most important characteristic of a successful collaborative encounter among clinicians. If clinical competence is absent, the trust and desire needed for collaboration cannot exist. In evaluating clinical competence, it is unnecessary to examine the role, title, or status of each partner. The idea that physicians are the leaders of the collaborative efforts is no longer the prevalence. According to Hamrick, leadership is problem-based and is an open sharing power system. In an open shared power system, the problem guides the efforts of each individual task, with the partners contributing valuable experiences that could offer possible solutions. In this openness, each partner is allowed openly to share possible solutions and learn from each other, further contributing to the trust and respect.
Hi, Hi, my name is Courtman Rollins, and I'm going to discuss more about the characteristics of collaboration. Each team member must share a common purpose. Most often, the goals are inherent in that each member understands the cure or relief of symptoms is the goal of collaboration. Organizations and entities generally have mission statements or goals for carrying out the work that is done within the facility. Those who are guided by a common vision, who believe in value of collaborative efforts, and who are committed to achieving the potential of the relationship will be able to move toward an experience of shared knowledge, information, and skills, regardless of disciplines. Interpersonal competence is another characteristic of collaboration. It is the ability to effectively communicate with colleagues in different situations. Those situations are often routine and lack difficulties. However, they can be stressful and bear disagreements of value. Understanding the importance of interpersonal competence is to the advanced practice nurse's ability to communicate with other disciplines. The challenges for the AP are to feel confident in their skills and experiences to speak up openly about the situations that arise. APNs should feel comfortable by the fact that physicians have reported that the communication skills of NP has added value to and enhanced patient interactions and facilitated communication among staff. Also challenging for the APN is the idea of conflict resolution through assertive communication. Stepping forward to take risks, discuss disagreements and clinical judgments, and agree to criteria for resolution require courage, but when mastered, will gain trust for the new APN. Discipline diversity is another characteristic of collaboration. Along with trust and respect, there must be appreciation for the diverse and complementary knowledge brought to the environment. An equal commitment to quality and patient-centered outcomes and willingness to work together as a team. It is essential to recognize that each discipline has different goals and learning standards, which when combined may add to the restoration or relief of burdensome problems for the patient. The goal should not be that the chief detective winning by solving the case, but instead the goal should be that the entire force learns from the experience of others and collectively piece the puzzle together for effective resolution through their collaborative efforts. And lastly, humor cannot be ignored as a valuable piece in efforts of collaboration. Humor serves to decrease defensiveness, invite openness, relieve tension, and deflect anger. For the new APN, understanding humor and its appropriateness may help to set the tone for acceptance, allow for disagreement, diffuse conflicts, and refocus to meet the original goals. Quote by Helen Keller, "Alone we can do so little, together we can do so much."
Hi, my name is Lynn Sinnick, and I'm going to describe a couple examples talking about AP-RNs using collaboration in everyday practice. I work on an LTAC, and we recently had a patient that while eating breakfast that morning, he went into ventricular fibrillation. Code Blue was called, and during the code, the nurse practitioner for his interns was on call. She immediately came to the hospital. After the code was over, we found the patient had an AICD that did not go off. The nurse practitioner began to question us what had gone on, and then we immediately contacted cardiology, pulmonology, the electrophysiologist for the patient, and we also called Medtronic to come evaluate the pacemaker to see why it did not work properly. Whenever everyone got there, the nurse practitioner for the patient talked with all the doctors. They collaborated very well to figure out what had gone on. Since the patient was eating, the first possible cause was that the patient had aspirated. That was ruled out by the pulmonologist. And so the electrophysiologist, the Medtronic rep, and the cardiologist then were able to find that they ruled out an MI. And so the next possible cause was the defibrillation lead going from the defibrillator into the heart was faulty. The only possible thing to do now was to change the lead out. Had the nurse practitioner not consulted all those different doctors, then they would not have found that the patient had a bad lead. They would have not have ruled out all those other causes, and the care given to the patient would have suffered. The next case I would like to describe is on the same LTAC. Recently there was a patient there for 4 weeks of antibiotic therapy.
After receiving 2 weeks of antibiotics, the patient had some type of family emergency. The nurse practitioner was called because the patient was demanding to leave. She came, she evaluated the patient, and after speaking with her collaborating physician, they decided that the patient was able to go home if they could have home health. Now, the patient was going to leave AMA regardless. The patient was leaving, and if she left AMA, she would not have gotten home antibiotic therapy. Luckily, the nurse practitioner collaborated with her physician and also the case management that was helping take care of the patient. And they were able to get the patient home antibiotic so that she could finish her course of antibiotics and that her care was not changed.
My name is Jennifer Waddell, and I'm going to be presenting 2 more examples of collaboration in the practice of an advanced practice registered nurse. One example of collaboration is a nurse practitioner is seeing a patient in clinic with COPD. He has complaints of increased shortness of breath over the last week. The nurse practitioner knows that the patient has home health and also wears 2 liters of O2 at home. The nurse practitioner can collaborate with the home health nurse and an agency of people that have been caring for him and ask them what his oxygen saturations and all over health status have been over the past couple of weeks. That way they can know what's been going on and not just what's happening today in clinic. Another example of an advanced practice registered nurse collaborating in the clinic setting is a patient comes in complaining of an ulcer to his toe. The patient is an insulin-dependent diabetic, and upon assessment, the toe is very swollen with eschar present on the palmar aspect. The nurse practitioner collaborates with the podiatrist to create a treatment plan for that patient.
Hey, I'm Jolie Ainsworth, and I'm going to discuss the current research regarding collaboration. According to the early research, collaborative relationships lead to improved patient outcome as well as improved patient satisfaction, personal satisfaction, and professional satisfaction for the healthcare providers. The benefits of collaboration were first studied in 1979 through the National Joint Practice Commission demonstration. The data obtained in this study proved that the patient outcomes were improved, but the project was stalled and no further research was done until the 1990s. In the 1990s, the benefits of collaboration were again addressed and became a topic of interest. Research found that the positive outcomes related to nurse-physician collaboration were again positive. In these studies, it was found that mortality rates in ICUs were decreased, length of hospital stays were reduced, as well as hospital costs, and an increased ability to meet the patient and family's needs. Provider benefits of collaboration include increased sharing of responsibility, increased sharing of expertise, improved communication, increased personal satisfaction, enhanced mutual trust and respect, and avoidance of redundant care.
I'm Andy Cloud, and I'm going to be talking about current research on collaboration. The Pew Health Professions Commissions, the Robert Wood Johnson Foundation, and the Institute of Healthcare Improvement have been involved in initiatives to encourage collaboration. The Pew FedServ Task Force identified 3 areas of collaborative care core competencies needed to deliver relationship-centered care. These areas are patient-practitioner relationship, practitioner-practitioner relationship, and practitioner-community relationship. The Institute of Healthcare Improvement has produced a series of papers concerning collaboration. These documents have set forth the framework and principles to facilitate collaboration amongst healthcare team members and their organizations. Lack of collaboration can lead to increase in patient costs and provider costs, an atmosphere of negativity, territoriality, and competitiveness, which also leads to job satisfaction and increased turnover. Focus needs to be placed not only on the importance of collaboration relationships, but also strategies to incorporate these relationships in practice to promote effective communication. By improving collaboration and communication, professional satisfaction and patient outcomes will both be enhanced.